Lasprugato, mental health therapist and peer-reviewed acceptance and commitment therapy trainer. And I'm very excited to be joined today by, in order from left to right on your screen, Tom Szabo, Evelyn Gould, Jonathan Tarbox, and Stephen Hayes, who are gearing up to put on another Praxis-hosted ACT BootCamp for Behavior Analysts. And this is going to take place in Baltimore, Maryland, from September 27th through September 30th. And as a facilitator for some of the introductory two-day workshops through Praxis, one of the most common questions that I've encountered from behavior analysts at the end of the workshop is essentially where to from here. You know, they would like to know how to further their training beyond the introductory two-day Act 1 workshop. I feel especially fortunate to be joined by all of you and to hear about kind of what happens at an ACT bootcamp for behavior analysts. So with that said, I know there's both the bootcamp for behavior analysts and then there's also the two-day workshop for behavior analysts. And so I was hoping that you might tell us about how they're similar versus distinct from one another. And Tom, I know that you've had a hand in both of these workshops, and I'm wondering if you'd like to start with that question.
I'm not alone in that, Jonathan as well. But yeah, I mean, Adele Nadowski and I just came back from Tampa, Florida, and we got exactly that same question that you've been getting. What's the next step for me? Which is the next training that I should go to? How do I continue to develop my skills? And I think it's a little bit like going to grad school. You get a master's degree, and en route you decide, I want to get a PhD. And most grad schools, most master's programs say, great, we are really happy that you want to do that. We'd like you to apply to a different school for your PhD. And the thinking behind that is to broaden the breadth of your training. Get training from as many different people as you possibly. You've got the founder of ACT, as well as a number of different people who really come at it from different angles. I'm pretty certain that Evie and Jonathan and Steve and I all do things very differently.
Well, another feature I think is that, you know, just the length of time in the evening sessions and the diversity of the training, you know, rounds things out, builds things out. So people can come in without exposure and come out ready to do some things. I think the 2 days, very often you come out, if you come in without experience, you go out with serious interest and with a commitment to do further training. And maybe you're not ready to actually, you know, get in there and rock and roll. One of the things I think it's a little different than ACT and ACT bootcamp is that it isn't just ACT, we're also dealing with RFT, and we're linking it up to a particular wing of behavior analysis. So it depends on what wing you've come out of and how you think about things. When you kind of enter into this area, you're into a multi-year journey, not so much because you're just learning a technology, but because you're learning a different take on the field itself that interacts with all of what you know, doesn't contradict anything that I can think of, but it builds on it in ways that are dynamic and sort of change how you see even, for example, direct acting contingencies in the work that you're doing there because of the interaction with what happens with relational framing and so on. So one final thing is that there's a little bit of space there for looking personally as well, because it's built on a psychology that applied behavior analysis is built on more generally. There's very few behavior analysts who wouldn't be thinking about their own lives in contingency terms. But when you expand it out in this way, you really then have to look more carefully at that, you know, what about your own private events and how are they getting in the way? And so that takes a little bit of time, and bootcamp gives it to you.
Thank you. And would anyone else want to add anything to that?
Sure, yeah. One thing I'd add is I guess I just think about all of this stuff as generalized repertoires that clinicians are trying to build. And like everything in behavior analysis, it's based on a functional understanding of the client's behavior and of our own behavior as clinicians. And, you know, building that generalized repertoire of thinking about your client's behavior, not just their relatively simple overt behaviors like tantrums and aggression and mans. Let's face it, it's complex and it's difficult. And I do think it takes thousands of exemplars of training on how to do that. And so in 4 days, you get a lot more exemplars than you get in 2 days. And, you know, none of us are ever done, so.
Sure, yeah. Thank you. So if I was kind of considering, like as a behavior analyst, if I was considering attending one of these events, you know, I might ask myself, well, how would training in ACT, specifically in acceptance and commitment therapy, how would that benefit my practice? Like in the work that I'm already doing with my clients, how might that benefit them? Can each of you speak briefly to this?
I feel like there's a few different pieces. I think Steve touched on some of them, but what we do as clinicians in behavior analysis is really hard. We're really working with clients whose behavior is causing a lot of difficulty for themselves and for the people around them. There's a lot of excitement and joy and reinforcement to be had from this work, but it's also very, very challenging. And the question is kind of, how do we as practitioners keep our behavior analysis hats on whenever distress shows up, because it inevitably will, given the challenges of the work that we do all the time, whether we're working with parents or kids, teachers who are struggling, staff members who are being faced with really significant challenges every day in their work. We know that I think a European Journal of Behavior Analysis recently published a paper arguing that while behavior analysis is one of the most rewarding careers, it's also one of the most stressful, and we experience a lot of burnout in this kind of field. So I think the question of like, what do we do as BCBA practitioners whenever we're dealing with our own distress, as Steve touched on, like our own aversive private events, and what do we do whenever we see those aversive private events showing up in our clients or in the parents we're working with? How do we respond to that? And what I see a lot of the time is that we don't know how to respond to that. We take our hats off. It's like the person starts talking and expressing distress, and we take our behavior analysis hats off. And so I think the ACT BootCamp can really help you in terms of, all will be faced with failure at some point and struggle whenever we're doing this kind of work, how to keep our behavior analysis hats on while we do that. And then the other piece I think that bootcamp can bring is just this understanding of complex language and intervening with complex language, because behavior analytic practitioners basically are talking to people all day long. We're interacting with highly verbal adults most of the time, whether it's us talking to staff who are working with kids, trying to get them to do what we need them to do in order to help the kid, whether it's we're talking to parents and trying to get them to do what we need them to do with the kid, whether it's talking to teachers, whether it's talking to peers. We're not just working with young kids with autism on the spectrum, we're working with all these highly verbal humans who we are trying to get to do hard things. So I really think understanding, again, how to use language skillfully is going to really help you do an effective job. And at the moment, most behavior analysts are not trained to do that. They are talking all day long and not doing it skillfully. So I think that piece, and then like Steve mentioned, the personal piece, like really being able to be present, mindful of your own private events and how they're playing a role in your interactions with the people that you're working with every day, and not letting that get in your way and create problems for you, but also for your clients.
I really appreciate your response, Evelyn. Just to kind of highlight a couple points. So what I'm hearing is that the bootcamp can give BCBAs tools to deal with their own aversive private events that might be showing up in the work that they're doing, so that they can effectively navigate those in a way that that's not impairing the work they do with their clients, but also just to have a better understanding of how human language and cognition's naturally showing up and influencing behavior all the time, and how that can also and how that plays a role in both the parent-client interactions as well as the interactions between the behavior analyst and the client. Is that correct?
Well, you know, one of the things I think that's cool about if you just stay with the empirical side, never mind the hope, the promise, you know, where we're going as a field. You know, we have pretty good evidence that bringing some of the psychological flexibility processes that we spent decades developing inside a behavioral research tradition, as we sort of unpack the repertoire narrowing effects of rules and try to figure out how to put that under good contextual control. You know, those processes lead to lower levels of burnout, greater motivation by staff, greater likelihood that they can follow through with behavioral regimens, but not just staff. That's true of parents too. They're more likely to persist, likely to drop out. They have fewer mental health and emotional problems, and they're more able to follow through with the procedures. And in addition, as we do this, we realize that it isn't just the high-functioning people that we're dealing with and so forth, that these issues of private events and the way they intrude, once you get on past a mental age of 3 or so, you're dealing with things where you require a technical account that is more adequate. And what has happened is that we've allowed in the field, not really meaning to, but we've allowed this idea that we just don't go there. So if you're talking about thoughts, if you're talking about feelings, we just don't go there. Well, Jonathan, I heard Jonathan say this first, and I agree with it. If you do that, it means, this is Evelyn was saying, you still go there. It's just you go there mentalistically.
Right.
Well, what else? What is the other choice you got? You're gonna not, somebody comes in crying and they're talking about how desperate it feels that their child isn't making progress or something. You're not gonna put tape over your mouth. You're gonna say something. Mm-hmm. Well, what is the theory that is driving that moment? Is it just a wagging finger of follow the program, follow the program, follow the program? I mean, you could program a computer to say that. You're not going to do that. You're going to reach out. You're going to empathize. You're going to try to help remove these barriers and get the parent, for example, re-engaged. Well, that's fine, but that's a professional issue. That's behavior. We need an account of that, and we need to do a better and better job of that over the years. And so I think we've just seen that the expansion that the contextual behavioral science view gives to behavior analysis, it's just another face of behavior analysis. It's part of the same tradition. It's just that it has moved along over the years and now sitting on hundreds of, several hundreds in some cases, studies. That it's time for us as a field to make use of it. And so fortunately, there are things in the task list that open the door. And I think people are seeing very quickly as they do this that it has benefits for the recipients of care and for the providers and parents and so forth who need to be engaged, the teachers and so forth. I think it's changing how people view even behavior analysis itself. That's an exciting journey, that we don't have to trash our traditions to move forward. After all, our tradition was a very bold one, established by people who are willing to have new concepts, new methods, new analytic approaches, new techniques. There's no reason for us to slow down in that journey. And so it's a stream that's come back in. And I think if you just, and you'll see it at boot camp, if you just stay with the evidence, if you bring your skepticism with you, not cynicism, but skepticism, you'll never have to check your mind at the door and never have somebody say hallelujah. You never get a tattoo. Nobody's going to, make you perform the chicken ritual. I mean, it's just behavioral science moving on for the good of the people we serve.
Wait a minute, Steve. There's no Kool-Aid? Where's the Kool-Aid?
Only at the 7th level after you dive to the fountain.
I'm not there yet. There's one thing that nobody has mentioned, which is there's a worst case scenario, which I think probably each of us here have seen before, which is people saying, you're crying. Oh, I'm so sorry you feel that way. You probably should go find somebody to talk to about that. I mean, yeah, we got to stop doing that. We need to have a better way of responding, which is not just not mentalistic, but also not shirking away from it. Or in the case of those kids who are just developing verbal skills and recognizing, oh my God, they're laughing at me. They're not laughing with me, pretending that they didn't say that and just saying, okay, let's go on to the next task in front of us. We need to stop that. We've got a better way. We've got a better solution here. And it's, as Steve was saying, it's just not abandoning our behavioral principles. It's making use of everything that the last 30 years has brought to bear.